All right, welcome. Today we're heading out on a grand tour of a bone that's, well, pretty remarkable. It's the silent pillar that carries you through your entire life. So let me just kick things off with a question for you. Any idea what the second largest bone in your body is? You know, the one that carries most of your weight? It's not the femur, that's the biggest. So what's number two? That's right, it's the tibia, or as you probably know it, your shin bone. And today, we are giving this absolute powerhouse the spotlight it really deserves. And its job is just so important. I mean, the official definition calls it the pre-axial bone on the medial side of your leg. All that means is that it's the main weight-bearing bone on the inner side of your lower leg. Its whole purpose is to act like a biological support column, channeling all of your body weight from your thigh bone, the femur, all the way down to your foot. It's really an incredible piece of natural engineering. So to really get a feel for it, we're going to take a little tour from the very top to the very bottom. We'll start up at the upper end where it helps form the knee. Then we'll travel down its long central shaft and we'll finish up at the lower end, which, you guessed it, forms the ankle. Ready? Let's go. First stop on our tour, the upper end. This is the wide, kind of flared out top of the tibia that creates this flat platform for your knee joint to sit on. This is where all the action really begins. At the very top, you've got these two platforms. They're called condyles, and they're not identical twins, not at all. The medial one, that's on the inside of your leg, is bigger and more oval-shaped. The lateral one, on the outside, is a bit smaller, more circular, and it has this neat little spot where its partner bone, the fibula, connects right up to it. Now, nestled right between these two smooth platforms is a rougher patch of bone called the intercondylar area. You know, it might not look all that fancy, but this is some of the most important real estate in your entire knee. Think of it like a super busy docking station for some very, very famous ligaments. And here they are. This one little area is packed with 6 vital attachments, and we've got them listed here from front to back. You've got parts of the menisci, those are the knee's shock absorbers, and of course the big names, the ACL and the PCL. This exact order is absolutely critical for keeping your knees stable. But how on earth do you remember all that? Well, you do it with this fantastic little memory aid. Medical College London, London Medical College. See, the first letter of each word, M, C, L, L, M, C, matches the first letter of each of those 6 structures in perfect order from front to back. It is an absolute lifesaver for anyone studying anatomy. Okay, time to continue our tour. We're heading down from the knee now, moving along the main body of the bone, which is called the shaft. This is the long, straight, super strong pillar of the tibia. So the shaft is kind of triangular in shape, which means it has 3 distinct borders. The most famous one is that anterior border. Go ahead and feel it right now. That's your shin. It's sharp and it's subcutaneous, which just means it's right under the skin. The medial border is a bit more rounded, while the lateral border, on the outside, is also sharp because it acts as an anchor for a membrane that connects the tibia to the fibula. And between those 3 borders, you get 3 surfaces. The medial surface is that broad, flat area right next to your shin, also just under the skin. The lateral surface is where a key muscle that lifts your foot gets its start. And then there's the posterior surface on the back, and that one is by far the busiest of all, just covered in muscle attachments. On that busy back surface, there's a really important landmark. It's a diagonal ridge called the soleal line. This line is a crucial attachment point, not just for connective tissue, but also for the powerful soleus muscle, one of the main muscles in your calf. And speaking of muscle attachments, let's just hop back for a second to that medial surface, near the top. 3 really important thigh muscles attach right here in a very specific order: the sartorius, the gracilis, and the semitendinosus. This is another one of those spots where knowing the precise anatomy really, really matters. So, of course, we have another fantastic mnemonic for you. To remember the order of sartorius, gracilis, and semitendinosus, just picture this: a girl between 2 surgeons. Get it? SGS. It's just a simple, clever little trick to keep all that anatomy straight in your head. All right, we have made it to the final destination on our tour, the lower end of the tibia. This is where the bone flares out again, and this time it creates the crucial upper part of your ankle joint. Now, this end is a pretty complex little structure. It actually has 5 distinct surfaces. Its main gig is to form a kind of socket that fits perfectly over the talus bone in your foot. It also has a special little triangular cutout on the side, the fibular notch, which is right where the fibula tucks in to complete the whole ankle joint. But the most obvious feature down here is the medial malleolus. This is that big, bony bump you can easily feel on the inside of your ankle. It's a short, super strong projection, and it is absolutely essential for keeping your ankles stable. And that bump isn't just for looks. It serves as the main anchor point for the incredibly powerful deltoid ligament. That's a thick, tough band of tissue that basically stops your ankle from rolling inwards. Okay, so now that our tour is complete, let's talk about why all these little details actually matter in the real world. We need to look at the tibia's clinical significance because, trust me, when things go wrong with this bone, it's a very big deal. This simple fraction right here points to the tibia's biggest weakness. The most common place for this bone to break is right at this spot, the junction between the upper 2/3 and the lower 1/3 of the shaft. It's the narrowest part of the bone, which just makes it a natural point of weakness. And what makes a fracture here even worse is that this specific area has a pretty poor blood supply. That means when the bone breaks, healing can be incredibly slow. These fractures are notorious in the medical world for something called delayed union, or even non-union, which is where the bone just really struggles to knit itself back together. And just one last clinical note for you. The upper end of the tibia is a common spot for bone infections, what we call acute osteomyelitis, especially in kids. But what's really interesting is that because of where the knee's joint capsule attaches, the infection usually stays inside the bone and doesn't spread into the knee joint itself. So there you have it. From the knee all the way down to the ankle, the tibia is just a masterpiece of strength and functional design. This one pillar supports every single walk, run, and jump you ever make. And it kind of leaves you wondering, doesn't it? What other incredible marvels of engineering are hiding in plain sight right inside our own bodies? Thanks so much for joining me.